What this means for us is that we still have an opportunity to take some important steps to prevent getting sick, steps that can make a real difference in our lives and in those with whom we live and work. Some of the things that we can do to reduce the risks of respiratory illness include some common sense steps that we've learned even when we were young. Things like washing our hands often and covering our mouths when we cough. Also, if you're not feeling well, or if you have active symptoms of an illness, please stay home. Or for parents, keep your children home from school. If you're in a crowded environment, pay attention to the ventilation. If it's possible to crack a window or do something to improve air circulation, that can be very helpful to do. Looking at COVID-19, Ohio's case numbers this fall declined from a late summer increase, but I want to caution us not to get complacent, as the disease continues to cause hospitalizations and deaths across the state. An average of 20 Ohioans still die of COVID-19 each week. More than 1,100 Ohioans have died of COVID-19 this year, and nearly 7,000 Ohioans have been hospitalized. Even as the virus continues to evolve, we need to remember that it can still cause severe illness and death, particularly among those who are unvaccinated. The CDC recommends that everyone 6 months or older receive an updated 24-25 COVID shot to protect against severe disease this fall and winter. This is particularly important for those who are 65 and older, or who are immunocompromised, or have certain chronic medical conditions. Data continues to show that vaccination lowers the risk of COVID-19 infection, hospitalization, and death. It also can reduce the risk of developing what is known as long COVID, a set of debilitating symptoms that can linger for months or even years after infection. Now, turning to influenza, our statewide flu activity also remains low. But again, we'd expect to see that start to change, as generally we see an increase around the end of the year and into January. It's certainly not too late to get the protection that a flu shot offers. And again, this is especially important for those in more vulnerable groups, some of the groups I just mentioned. RSV numbers are low as well, but are in fact slowly increasing. There's a vaccine for women who are between 32 and 36 weeks of pregnancy through the month of January, as well as an RSV antibody shot available for infants whose mothers were not vaccinated during their pregnancy. There are also RSV vaccines for those ages 60 and older. The CDC recommends an RSV vaccine for those ages 60 to 74 if they are at increased risk, or for everyone who is 75 and older. Now, these RSV vaccines are not annual vaccines, so if you have already received one, you do not need another one at this time. As always, consult your medical provider with any questions you might have about vaccines, as they know you and your medical history and can give you the best possible advice. Now, I'd like to turn to a few respiratory illnesses that are drawing increased attention lately in Ohio: pertussis and mycoplasma pneumoniae, sometimes called walking pneumonia. After seeing lower numbers of reported cases in the past few years, during and after the COVID-19 pandemic, across the nation, pertussis, or whooping cough, is now returning to its pre-pandemic trends. In Ohio, this is no different. So far this year, Ohio has seen over 1,400 cases. This is higher than what we saw last year, but is consistent with some years prior to the COVID-19 pandemic. Between 2010 and 2014, for example, Ohio reported an average of over 1,200 cases annually, including over 1,600 in 2013. Early on, in the first week of infection, pertussis may feel like many other respiratory illnesses with a runny nose, low-grade fever, or an occasional cough. After a week or so, people may develop coughing fits that can end up being very severe. Some people have described it as the worst cough of their life. For babies, this illness can be more than an inconvenience. It can be life-threatening, as they can struggle to breathe even if they don't develop coughing fits. This serves to highlight the importance of our childhood immunization series, one of which is the DTaP, or diphtheria, tetanus, and acellular pertussis vaccine. Now, none of us wants to expose little ones to this illness, and no parent wants to see their child suffer. Keeping up to date with the recommended immunization schedule can help prevent this. In Ohio, again, as we have seen nationally, childhood immunization rates slipped during the pandemic years. They began to rebound in the 22-23 school year, but as I mentioned last summer, they leveled off in the 23-24 school year and have not yet reached pre-pandemic levels. In the 2019-2020 school year, 92.3% of Ohio kindergarten students have received the DTaP vaccine. This past year, that number was 89.3%. That 3% drop equates to about 3,500 fewer children vaccinated for these illnesses statewide. We encourage everyone to do what they can to improve that rate. Now, I'll turn to Mycoplasma pneumoniae, which is sometimes known as walking pneumonia, because its symptoms may not be as severe as one might expect for what might actually be a case of pneumonia. Nationally, the CDC has reported an increase in this illness over the past 6 months, and levels have remained high nationally. Ohio has also seen an increase in reported outbreaks of mycoplasma, mostly in schools and childcare settings. Now, this is not an individually reported disease in Ohio, meaning it's not the kind of illness for which providers are required to report individual cases to us. So we don't have data on case numbers in Ohio. There is no vaccine for Mycoplasma pneumoniae, but if your child is having difficulty breathing, see your doctor, as this could be the diagnosis, and it is a diagnosis that can be responsive to antibiotics. Prevention for this respiratory illness goes back to what I talked about earlier. Proper hand and cold hygiene and staying away from others when you feel sick. All right, we've covered a lot of ground regarding these respiratory illnesses, and to help us further examine some of these important topics, I'd like to now welcome in our guest, Dr. Michael Forbes, Chief Academic Officer at Akron Children's Hospital and a longtime pediatric critical care physician. Dr. Forbes, we continue to hear questions about the need for and safety of childhood vaccines. As an experienced and respected pediatrician, do you believe routine childhood vaccinations are still important for Ohio's families? And can parents really be confident that these vaccines are safe for their children?
Yeah, great question. Again, thanks for having me. I can unequivocally say that routine childhood vaccinations are critically important for Ohio's families and for children everywhere. They're one of the most effective public health tools that we have to prevent serious and sometimes life-threatening illnesses, as you've mentioned, whooping cough, measles, and polio, particularly in vulnerable populations. The benefits of vaccines extend beyond protection.
Well, it looks, Ken, like we might have had Dr. Forbes, his feed freeze up. Is that what you're seeing?
Yes,
Okay.
he is still on the call, but The video is frozen. So
protecting the individual and contribute to who can't be vaccinated.
Hey, Dr. Forbes, you froze up partway through your answer. So I wonder if you might just sort of repeat what you said, because I think you were saying some important stuff.
Okay, I'll do it again. What I was focused on is one, I'll say unequivocally that routine vaccination in childhood is critically important for Ohio's families, children, and our community. It's one of the most effective public health measures that we can possibly take. As an intensivist, my mantra has been prevent what's preventable.
Yeah, absolutely. Dr. Forbes.
And so being able to prevent, really critical for us to be able to do that.
Yeah, that's absolutely true. I'm going to ask you one more question. I wonder if you just turn your video feed off.
Sure.
That might give you some more bandwidth. Now, as I noted, we're also seeing a rise in whooping cough across the country. What can parents really do to protect their families from whooping cough? And what should they do if they're concerned that someone in their household might have whooping cough?
I think I heard your question regarding whooping cough.
Yes.
I don't know if you can still hear me. Good.
I can. Yep. I can hear you.
The first thing is, I think the first step is to stay up to date on vaccines. The DTaP vaccine that you mentioned already is given at 2, 4, and 6 months, around 15 to 18 months, and then another booster around 4 to 6 years of age. But it doesn't just go for the little ones. Adolescents and adults are recommended as well. So our preteens around 11 to 12 years old, and for adults who've never received the vaccine, should also get it. I'll make a note about pregnant women. Pregnant women should also receive the DAP vaccine during every pregnancy, ideally between 27 and 36 weeks. And the reason you want to do it with every pregnancy is to really boost mom's immunity, to pass that immunity on to their very vulnerable baby. As you mentioned, in infants, pertussis can be deadly. As you've also alluded to, good hand hygiene, open water, and keeping infants and young kids away from folks who are coughing or show symptoms of coughing. That cough could be mycoplasma, could be rhinovirus, it could also be pertussis. Yeah. So protecting those babies is critical.
Thank you. Thank you very much. Well, as I wrap up today, I want to draw attention to an initiative that Governor DeWine announced earlier this year, the Recovery Friendly Workplace Program. This is a program designed to make Ohio a national leader in supporting people with substance use disorder. In October, I joined the governor in announcing Ohio's success at lowering the number of overdose deaths in our state. As pleased as we are with that progress, it's also very important for us to support those who are now in recovery. And this program is one way to do that. Employers can apply to receive a recovery-friendly workplace designation, which means they are fostering a workplace that encourages long-term recovery success and also reduces stigma and breaks down barriers. To learn more about how to become a recovery-friendly workplace, go to the recoveryfriendlyworkplace.mha.ohio.gov website, which we'll put in the chat here. Well, I want to conclude by saying again that taking preventative steps to protect your health is the best way that we can avoid many winter illnesses that can really disrupt our lives, as well as family gatherings this holiday season. None of us wants to get sick or miss these cherished events or put a loved one at risk for getting sick. Let's use our common sense, good hygiene practices, and if you're not vaccinated, consider getting a vaccine so that we can all enjoy a happy and healthy holiday season. Thank you. And Ken, I think we can go ahead and take any questions there might be.
Okay, we have a question from Sam Wildo, Dayton Daily News.
Hi, thank you guys for your time. My question is, what does the uptake of the COVID vaccine look like right now? And are there any concerns about that?
Yeah, so if you look at the numbers, and we do post these on our website, what you'll see is that the older Ohio population is actually doing a pretty good job of getting the updated vaccine, which is encouraging. We're seeing numbers that could be higher, but are every bit as good as what we saw in the previous year. But the fact is, we still have a lot of Ohioans who could be getting the vaccine, and particularly in our vulnerable categories, including those over the age of 65, there's still quite a number of Ohioans who are missing out on the opportunity to protect themselves from this.
We don't have any other questions currently in the queue. If anyone else has a question, let us know. Otherwise, Dr. Vanderhoff, I think we'll toss it back to you for any final thoughts.
Well, thank you. First, I want to thank Dr. Forbes for joining us here today and sharing his expertise. And thank all of you who have tuned in. And thanks, Sam, for that very good question. Have a wonderful holiday season, and we'll look forward to seeing you after the new year.